Periodontal researchers have been deeply engaged with modern cell biology, and cell biology has provided deep insights into the pathophysiology of periodontal disease. In the 1970s, periodontal researchers described osteoclast activating factor, now known as interleukin-1 beta, a key early discovery in the field of cytokine research. And now, the periodontal model is being actively used to investigate the regulatory and homeostatic functions of neutrophils. Microbiology research in periodontal disease has yielded profound insights into the nature of host-pathogen relationships. For example, we now know that some of the keystone species in the pathological biofilm, such as Porphyromonas gingivalis or Treponema denticola, actually hijack the signaling mechanisms of our innate immune system. They take over elements of the complement system and toll-like receptors, twist them to their own purposes. They use our own body's immune molecules to cripple the killing ability of neutrophils, to increase destructive inflammation, and to help populations of co-pathogens thrive in the periodontal environment.
The turn of this millennium brought some crucial new research on the undeniable connections between periodontitis and systemic illness. Notably, a major publication in 2009 linked periodontal conditions with heart disease. It was the American Journal of Cardiology and Journal of Periodontology Editors' Consensus, entitled Periodontitis and Atherosclerotic Cardiovascular Disease. The paper helped the medical community acknowledge the link between atherosclerotic cardiovascular disease and periodontitis and offered approaches for reducing the risk of primary and secondary atherosclerotic cardiovascular disease events in patients with periodontitis. This article, written by Friedwald V.E. et al., was published in both the American Journal of Cardiology and the Journal of Periodontology in 2009. It was titled the American Journal of Cardiology and Journal of Periodontology Editors' Consensus, Periodontitis and Atherosclerotic Cardiovascular Disease. Recent studies have likewise offered new information that suggests disease in the gums can spread to other parts of the body, and or disease in other parts of the body can impact the gums. A research article by Lee, Koltveit, Tronstad, and Olson, published in 2000 in Clinical Microbiology Reviews titled Systemic Diseases Caused by Oral Infection, examined the links between periodontal disease and cardiovascular disease, infective endocarditis, bacterial pneumonia, low birth weight, and diabetes mellitus. The researchers specified that bacteria from the mouth could be passed to the bloodstream. Quote, with normal oral health and dental care, only small numbers of mostly facultative bacterial species gain access to the bloodstream. However, with poor oral hygiene, the numbers of bacteria colonizing the teeth, especially supragingivally, could increase 2 to 10-fold and thus possibly introduce more bacteria into tissue and the bloodstream, leading to an increase in the prevalence and magnitude of bacteremia. End quote. The source of this again is Lee, Koltveit, Tronstad, and Olson, Systemic Diseases Caused by Oral Infection, Clinical Microbiology Reviews 2000. Other researchers have explored the association between oral infection and illness as well. Michaud, Joshipura, Giovannucci, and Fuchs concluded that men with gum disease, particularly those who lost teeth within the past 4 years, were more likely to develop pancreatic cancer. The source for this is Michaud, Joshipura, Giovannucci, and Fuchs, a prospective study of periodontal disease and pancreatic cancer in the U.S. male health professionals. Journal of National Cancer Institute, 2007. Other areas of research with growing evidence of links to periodontitis include cardiovascular disease, gastrointestinal and colorectal cancer, diabetes and insulin resistance, respiratory tract infections, adverse pregnancy outcomes, anemia, chronic kidney disease, and rheumatoid arthritis. The sources for this are F.Q. Bui et al. Sources are Bui, F.Q. et al., The Association Between Periodontal Pathogens and Systemic Disease, Biomedical Journal, 2019. Balakasavan et al., Balakasavan P. et al., Periodontal Disease and Overall Health, an update, European Journal of General Dentistry, 2013. Kribel K. et al., Oral Biofilms from Symbiotic to pathogenic interactions and associated disease, connection of periodontitis and rheumatic arthritis by peptidyl-arginine diamynase, Frontiers in Microbiology, 2018, and Maresh K.J. et al., Porphyromonas gingivalis facilitates the development and progression of destructive arthritis through its unique bacterial peptidyl-arginine diamynase, PAD, PLOS pathogens, 2013. Furthermore, periodontal pathogens treponemas and Borrelia burgdorferi were identified in Alzheimer's disease cases by McCloskey in 2011. The source is McCloskey J., Alzheimer's disease, a neurospiroketosis, analysis of the evidence following Cook's and Hill's criteria, Journal of Neuroinflammation, 2011. However, the concept of pathogens playing a role in periodontal disease is far from new. For nearly a century, light microscopy has been applied to locating the parasite Entamoeba gingivalis in diseased gums. The source of this is Trim R.D. et al. Use of PCR to detect Entamoeba gingivalis in diseased gingival pockets and demonstrate its absence in healthy gingival sites. Parasitology Research, 2011. Treatments commonly practiced in popular modern dentistry, such as root planing and surgery, do not seem to address the current science or even the past practices from 100 years ago that recognize the role of pathogens and inflammation in periodontal disease. In fact, by removing parts of the body and/or making a number of surgical incisions, the disease could potentially be worsened and spread to other parts of the body, and different parts of the periodontium could be damaged as well. In an article titled, quote, Periodontal Medicine, 100 Years of Progress, end quote, published in 2019 in the Journal of Dental Research, the authors state that, quote, holistic interventions aimed at reducing the total systemic inflammatory burden by doing a phased targeting of all sources with periodontitis as the last phase may be the only means of achieving successful clinical outcomes, end quote. The source of this is Beck J.D. et al., Periodontal Medicine, 100 Years of Progress, Journal of Dental Research, 2019.